Our next speaker is Dr. Kai Pohler. He's also a professor at Texas A&M. He did his master's and PhD at University of Missouri, and then he was hired at University of Tennessee as an assistant professor 2015, and then joined Texas A&M 2018 and was recently promoted to associate professor. So Kai is one of the biggest names on pregnancy loss, pregnancy recognition in beef cattle, probably in the world right now. So it's a pleasure to have you here, and thank you very much for joining us.
Thanks, Philipe, for having us here. And yeah, I've never been to this part of Florida, but I flew from Miami to Tampa yesterday, actually twice. And the first time we circled for 2 hours around Central Florida, so I got a good aerial tour of what happens in this part of Florida. So that was kind of nice. We went back to Miami, got some more fuel, and came again. So yeah, so it was a good tour of at least from the air what's happening. So what I'm going to talk about, it's kind of dangerous when you ask a repro person to speak at a nutrition conference, because especially last. Speaking after Reinaldo, usually I need to clean up some jokes or some things that he made about me, but there was nothing today, so nothing to say there. But one of the things that I want to leave you with as we start here is, I think one of the biggest mistakes we make in the cow-calf side of things when we start sort of thinking about reproductive management is I get a lot of calls from people that are getting ready to start their breeding season, and they say, what can I do to increase my pregnancy rates? And the whole thing is that if you really haven't sort of done everything else right and done everything right from the nutrition side and sort of thought about it in a holistic way, there's nothing that we can do from the repro side to really overcome that. So we jokingly say that repro is the most important and is 20 times more profitable than any other thing you can measure in a cow-calf operation. But the reality is that it's sort of a summary of all the other things that you're doing. So for us in an academic setting, I ask students on the first day of class, how many just want to get a 70 and get out of here? And there's people that raise their hand. But the reality is, if you take 7 or 5 factors in beef production, so like nutrition, repro, health, animal welfare, whatever it might be, and you want to do 70% of each of those, the compounded effect is 70% times 70% times 70%, which results in a 24% outcome at the end of the day. And that's really what repro is and what drives that. So that's sort of, I'm going to talk about some individual aspects of repro, but those are things that we definitely have to keep in mind. And that sort of illustrates that here as we look at it and think about what's important. There's a lot of factors that go into that. But again, it all boils down to, when we look at and assess reproductive efficiency, I'm going to show you today that there's a lot that goes into it other than just the things that we think about from the repro side. So one of the things that I think is important is, what is the expectations? So anytime we start a breeding season or think about what is the maximum fertility of a beef cow, if you start to look through the literature and look at what the numbers actually are, the last actual review of what the modern beef female fertility-wise as sort of a whole picture was done in the late 70s. So I had a PhD student that basically went through the literature and summarized the last 40 years of what fertility has done in beef females across the world in the published literature, to figure out really what is the fertility that we're seeing today, and what are expectations that we can achieve from the reproductive programs and management systems that we're conducting. Now, unfortunately, most of this data is based in controlled breeding seasons where we have estrus synchronization, AI, fixed time AI, or embryo transfer. So we're now trying to summarize this again in the bull data, but I'm going to show you our natural service data, but I'm going to show you this from sort of reproductive technology today. So as we go through, you have these different periods of loss. So essentially from day 0 of when you have fertilization taking place all the way till we can do the first pregnancy diagnosis at day 28, we summarize this whole period as early embryonic loss. Okay, so basically, if the cow is bred by the bull or bred by artificial insemination, or an embryo is transferred and she's not pregnant at day 28, we consider that early embryonic loss. And I'm not going to show the loss in the first 7 days, but it's highly variable and really dependent on the production system, how much loss happens in the first 7 days. So we're going to summarize this as the first 28 days. And then as we get past that first 28 days, we move into a next period of loss called late embryonic or early fetal loss. And my oldest brother's a veterinarian, so I like to make this joke all the time. how many people have had someone preg check their cows, somebody called them pregnant, turned them out, and they never had a calf. And, sort of the thing is, well, it's either the vet's fault or my fault for the pregnancy diagnosis, whatever. But there's a percentage of cows that lose pregnancy during that window. And those are probably one of the most expensive females that we have in the operation. And the other thing is, if you have pregnancy loss occurring after 70 to 80 days of gestation, 99.9% of the time, that is disease-induced pregnancy loss. So from a normal physiological point of view, we don't have pregnancy loss in beef cows or beef heifers that occur after about day 70 of gestation. So anything that occurs after that is very high probability a disease-based situation or just some crazy environmental factor that you didn't have in previous years. So this is the way I'm going to break it down and talk about it. So basically, we wanted to go through and summarize and figure out what's going on from a pregnancy loss. This is what we included. This is what we excluded. Basically, just showing that we excluded anything that had dairy relevance, anything with twinning, any treatments that negatively impact pregnancy rates. They were put in studies to do that. We removed all that data. So basically, once it was all sorted out, we had about 100,000 records from, I don't know, 15, 20 different countries, representing a number of different breeds. And, I don't need to show this here, but a lot of people and give talks around the world. They want to know what a Bos Indicus cow is. So we definitely looked at the difference between Bos Taurus and Bos Indicus. Obviously, parity was another factor, but we included all factors that were included in all the studies. I'm just going to talk about some of the three main ones today. The Bos Indicus, Bos Taurus, the parity factor, and then what type of reproductive technology was used. So this is the early embryonic mortality side. So this is the first 28 days or first 28 to 32 days of gestation. Each one of these numbers here represents the numbers of studies, not the number of cows. So there's over 50,000 diagnostic records when you look at this individual set. Overall pregnancy loss in the first 28 to 32 days in the modern beef cows, 47.9%. So what does that mean? If you take 100% minus 47.9%, the average pregnancy loss that's occurring, or the highest pregnancy rate on average that we're seeing, is slightly above 50%, okay, in these reproductive management programs. If you start to break it out by parity, have heifers, primiparous cows, multiparous cows, no surprise, those primiparous cows are having the highest pregnancy loss in the first 28 to 32 days. Now, one of the things that's critical, and I think that we have to watch, especially in Texas and in Florida, is that the Bos Indicus females have higher pregnancy loss in the first 28 to 32 days compared to Bos Taurus. And people ask me all the time, well, is it because Bos Indicus females have decreased fertility? And I think that's absolutely not the case. In fact, I think it's the opposite. But I think the situation that we're putting them in from an environmental point of view and a sort of a nutritional point of view really challenges them in that first 28 to 32 days of gestation. And so, there's opportunity to definitely decrease that loss that's occurring there and increase the fertility in those cows. Breeding method, pregnancy loss in AI from an AM/PM rule, breeding based on estrus had the lowest pregnancy loss, fixed time AI about 50%, and then embryo transfer about 55%. And this is the variation that's surrounding it. So, when I talk to producers and they want to know what can I expect from a day 30 preg check in Bos Indicus cows undergoing a time AI protocol, basically I tell them, well, on average, what we would expect is somewhere around 50%. So these are pregnancy rates now. So I just subtracted those numbers out from each of those, and you can expect somewhere in the range of 50 to 55%. And I think that's exceptionally good when we take into account that a high majority of the females that are entering the breeding season are not cycling, are challenged from the calf point of view. On the primiparous side, they're still growing, right? There's a lot of factors that go into that. Now, as we move into the next 30 to 60 days of gestation and look at this late embryonic window, the overall estimate for pregnancy loss in this window is 6%. It ranges somewhere from about 3 to 10 to 11%, depending on the herd, depending on the location, depending on the stress that's taking place. But as we go through here, no difference in Bos Indicus and Bos Taurus in this case. So those females are losing pregnancy in this window at a equal amount. Now, one thing that has been rather surprising to me, and we have followed up on this, and this is definitely the case, and I think something that we're going to have to keep an eye on, is that our virgin heifers, or our nulliparous heifers, have the highest amount of pregnancy loss in this time window than any other parity. And if you look at it, it's about 8 to 9% compared to about 4 to 5% in our primiparous and multiparous cows. And where we're really seeing a big effect is in Bos indicus herds that are making drastic selections for puberty. So, you know, like where I grew up down in South Central Texas with Brahman breeders down there, where herds have gone from basically breeding females at 2 years of age to switching to breeding at 1 year of age, that drastic selection in puberty is having effects in regards to pregnancy loss. Now, what's the mechanism and how is that happening? We're not sure, but it's something that we're going to have to keep an eye on. And then overall breeding method, again, you can see higher pregnancy loss and embryo transfer. Anybody that does embryo transfer has known this for a long time. Now, final day 100 pregnancy rates out the door compounded together. Basically, they're summarized here. So in a Bos indicus female, on average, you can expect a day 100 pregnancy rate with all the pregnancy loss combined of being about 44.6% compared to Bos taurus about 50%. Now here, you know, when you start to look at the parity, multiparous cows or primiparous cows are definitely going to have lower pregnancy rates because they have higher pregnancy loss. All right, so those are things to think about and consider when we start thinking about realistic expectations for fertility of our herd. So basically, this is summarizing it all the way through, different time points of loss, basically on what I showed on the slides before. But a lot of times I get the question, well, what does it mean in regards to what, you know, like another industry like the dairy industry would have in regards to pregnancy loss? And, you know, in the modern dairy cow today, it's about 30% in early gestation compared to 20 in beef, and about 6 or 12 compared to 6 in beef. So those numbers are decreased, and I think that they're fairly stable. But one of the things that as we start to make genetic decisions and genetic selections for specific things, we have to remember that those are probably going to have bigger impacts on embryonic mortality, especially when we talk about things like puberty that have very drastic selection criteria around them, or milk, or things like, you know, compounding birth weight selection over time, low birth weight selection over time, etc. So the question really remains, you know, what drives pregnancy loss? So how can we go from a situation here where you have what seems to be a normally developing pregnancy, and then you basically get nothing out of that female? And why does it all matter? You know, if an ag economist ever saw this slide, they would probably never talk to me again, but this is how a reproductive physiologist does math, okay? So if you take days of calving and you have a group of females that you bred to time day I all on the same day, and the expectation is that they're going to start on day 0 of the calving season, right? Compared to ones that undergo early embryonic loss. So they got pregnant, they're going to lose a pregnancy in the first 28 days. Most likely they're going to get pregnant back the first cycle, right? So we're going to call them at least 21 days later in the calving season. We have these late embryo loss cows. They lose a pregnancy after day 28. If they do get pregnant, which is a very low probability that they still will get pregnant, they're going to calve at least 60 days later. And then obviously we have these females that never calved. You put some weaning weights in regards to that at 2 pounds per day. You can see the differences in the weaning weights. And then obviously calf value, depending on the year, is going to be highly impacted by that. And so if you start to think about what the cost of pregnancy loss is, it costs us a lot, especially when we start thinking about it from the nutritional side, because it all costs the same to maintain. So until we figure out, like, okay, if you're going to lose a pregnancy, you go here, you get nothing, versus you're going to maintain your pregnancy, you go this way, it's a sort of equal distribution. And the reason that reproductive efficiency ends up hurting at the day is because of that, you know, let's say 10% that we think are going to calve and never calve, and you take them out of it, and reproductive efficiency is obviously very high. So what controls pregnancy loss? I'm going to talk a little bit about, you know, what drives it. And we used to think that, and you know, this still happens, if a cow ends up open at the end of a breeding season or calving season, who pays the price? Cow, right? She gets sold, gets slaughtered, goes to the auction barn, somebody else buys her, and it's their problem at that point. But really what drives it and what controls it. So as we look at what happens during the developing pregnancy, we go from sort of this, you know, very small embryo stage to basically a developing placenta, which Reinaldo talked about. And traditionally, we've thought about this situation that the bull has very high impact early on in gestation because of fertilization, because of, you know, delivering semen, etc. And then over time, it dilutes out to the female. So over time, it becomes more of the female's problem than the bull's problem. And so I'm just going to show you some of the data on both sides of that. And basically, I'll tell you at this point that most likely that thought process is not correct. Most likely, when females are ending up losing pregnancies and having high embryonic mortalities, it's really the bull's fault, and a combined effect of what would normally happen, and, you know, something from the genetic point of view is affecting that, and a lot goes into that. So maternally driven pregnancy loss, I'm going to first just show a little bit on the genetic side. The thing that I'll tell you is we really don't know how much genetic loss happens because of, or how much pregnancy loss happens because of genetics. Embryonic lethals, haplotypes, all these things that we see in an inbred population like the Holstein or the dairy industry really don't happen that frequently in cattle, especially in subspecies cross. So in the F1 females and in Brangus and Brayford, the chance to have a genetic lethal is actually pretty low. But I do think what's happening is, especially and there's data in Angus to show this, in selecting for low birth weight, for example, in Angus, and compounding that on multiple generations, we've seen about a 0.05% decrease in heifer pregnancy rates in Angus heifers. And you might say, well, 0.05 per year, that's not that big a deal. But if you think about it over time, you know, and you look at what happened in the dairy industry, right? They went from high fertility, moderate milk production, super high milk production, decreased fertility. And those cows were decreasing at about 1% per year, and nobody picked up on that, right? And so if we let those type of things happen over time, we will see a big effect in our population of animals that we end up with in regards to what their fertility is. So from the genetic side, it's really all over the place. Hormonal side, I'm just going to show a simple example here. So estrus, prior to time AI, so we still breed everyone at a given time, right? At a single day, at a single time. But if you look at estrus of those cows that come in, we score them based on using the EstruTech patch. We use a scoring system of 1 to 4 based on how much is rubbed off. We consider these to have no or low estrus, and these to have high estrus activity. And basically in all the beef herds that we've worked with, both in Brazil, heavily Boston influenced, and in the US, you can see that animals that don't show estrus versus animals that do show estrus have major differences in fertility. And, you know, when you start to think about where's the pregnancy loss coming from, the same thing is true. Animals that have decreased estrus activity, yes, they can get pregnant, but they also have increased pregnancy loss. And so it's sort of a double-edged sword. You have decreased fertility and you have higher pregnancy loss at the same time. And so at the time we were working with EstruTech to develop a system to score these patches. And it's when I learned that my graduate students couldn't figure out what 50% of the patch being rubbed off was. So we developed this new patch with EstruTech that has this black dot in the middle. And we jokingly say that this black dot is for the 50% of people that can't tell what 50% of the patch is rubbed off. So essentially, as you move forward and you see that patch rubbed off, as you get into these patches that don't have any, or that have the black dot completely gone, that's when you see that increase in fertility and the decrease in pregnancy loss. So from a management point of view, you can make decisions at the chute the day of breeding on, do I use a $50 straw of semen or do I use a $5 straw of semen? And, you know, those type of things I think are really useful from a commercial cow-calf point of view. The next thing that I'll talk about, just and Philipe and Reinaldo already talked a lot about this, and it's very dangerous for a repro person to talk about nutrition, but I think that one of the things that we have not done a good job of is looking at pregnancy loss from the nutritional side of things. A lot of studies out there that show effects from a number of different angles, but it's so hard to do these projects that we really don't know what the driving factors are. And all I'll say is that I think one of the most important things that we can do is maintain our herds with no or little change around the time of the breeding season. And if you have that, or the cows are increasing in plane of nutrition, that's positive. The only thing we want to avoid is decreasing their plane of nutrition. Well, in our own commercial cow herd, what do we do around the time of the breeding season? We synchronize the cows, we put them in a trap with low quality forage and bad hay, keep them up for 10, 15 days, breed them, and then turn them out. Well, that 10 or 15 days, I think, has a negative impact on them in regards to that first amount of pregnancy loss. So there was a study done a number of years ago that basically looked at the effects of weight loss in heifers compared to embryo quality and embryo stage. And so these heifers were either fed to gain or lose weight. And in 7 days, in only 7 days, it had a negative impact on embryo quality. All right, so very quickly things can change and really affect the uterine environment that leads to the effect of pregnancy establishment, pregnancy maintenance. Now, from the bull side, you know, I think that I say all the time that I was trained to basically work on the cow side and understand female pregnancy loss. But then I think from hearing my wife tell me all the time that everything's my fault, I thought, well, maybe it is the bull's fault. So maybe we should look at that side and see what's happening there. And this is just to give you an idea of the variance of sire fertility. Okay, these are all Angus sires that are used in Time AI projects. All of them have at least 1,000 inseminations. But look at the variance in pregnancy rates across here. I mean, you got a 9% all the way up to a 64%. These are all bulls that are major Angus names, all passed all major semen quality tests, all got out the door with high fertility, and yet this is the field fertility that we see. So what drives that? And basically, if we're going to increase fertility of our cow-calf operations, in my opinion, the easiest place to start is on the male side because of the limited number of males that we have in the production system. And so we did a lot of projects when I was a graduate student down in Brazil looking at this. This is another example. And this is looking at basically the marker for blood-based pregnancy testing, PAGs, where we have done a number of studies now showing that the male drastically affects what happens from a placental efficiency point of view and how efficient the developing pregnancy is in regards to the success or failure of it. And the other thing is that it's very dangerous to try to summarize fertility of a bull. So this is a study that I did when we were at University of Tennessee. Again, these are all Angus AI sires. We did early pregnancy diagnosis at day 24 of gestation and basically classified if bulls had early embryonic mortality, so that first window, and then whether they had late embryonic mortality. And what you can find is you can find bulls that have high early embryonic mortality, but when you move over to the late, the classification can change. And so, and we see this a lot in natural service sires, right? We see you turn out 5 bulls together, you'll have all bulls breeding, you know, a single female. And then if you look at your calf population, 75% of the calves are sired by a single bull. So how do those things happen? I think it's because we have these drastic changes in fertility, embryonic mortality out in the field that affect that. So last few slides here. This is so right now what we're doing is we're genetically and genomically looking at these bulls that have high and low pregnancy loss in both the early and the late window to develop genetic tools to be able to select animals that basically do or don't have that. So I'm going to show you, these are 2 slides. These are based on dairy numbers, but we're doing the exact same thing in beef. It's just, you know, it's very difficult to get each one of these bulls in this dairy slide here has 1,000 inseminations or 1,000 embryo transfers, but it represents this. So pregnancy at day 30 is in the black bar, pregnancy at day 60 is in this gray bar, and pregnancy loss is graphed in the blue bar. And what you can see is you can see bulls that have normal fertility across the board, right? All across the board. But look at pregnancy loss. We have bulls that have 0% pregnancy loss, and we have bulls that have over 40% pregnancy loss. That means 40% of the cows that were diagnosed pregnant don't go on to have a calf. We see the exact same thing in the beef numbers that we have. Not as high as 40, but there's bulls in there that, and I'm talking bulls that are in commercial AI studs that we are all buying semen from that have that type of pregnancy loss. If you look at the embryo transfer side, it's exactly the same. So there, and I show you this because it takes out the fertilization step, right? These are all produced in vitro, these embryos are. So that basically the sperm is put right on top of the oocyte in a plastic dish, and you're looking at it. So it's not just fertilization. It's pregnancy loss after fertilization in the developing pregnancy that we get to that. Yes, ma'am. No, yeah, it's a really good question. So all the basically we've run these bulls through different systems of flows, looking at you know, semen morphology, motility, etc., and there's no difference. And the scary thing is, and that is a scary thing, they all look the same, right? You can't look at the sperm and tell anything's different going on. And if you think about a bull BSE, for example, breeding soundness exam, yes, we've changed here in the last 3 years. There was an update to how BSEs are done, but from that, there's been no changes in measures of bull fertility for natural service sires out in the field, except for that. And it's a subjective based scoring system that, depending on how good or bad your microscope is, you can get different results. So I think that is the concerning factor from where I stand, as how can we increase fertility of our commercial cow-calf operations, where we know that sires are playing a major role, but we haven't had major advancements in how to select high fertility sires. So with that, I'll just conclude that pregnancy loss is normal through day 60 of gestation. If you're having pregnancy loss after that, most likely disease related. And it's very, very, very extremely difficult to find out which disease is the driving factor after that. And you'll get a lot of negative samples back, but there's no evidence that normal physiology or the normal cycle of the cow is driving that pregnancy loss. And probably half of the cases that we go out to that have pregnancy loss after day 75, we end up not being able to diagnose what disease actually drove that. But it seems that, or I'm pretty confident that that's the case. Obviously, the maternal side plays a major role. The cow is heavily involved. We heard about the nutrition side, genetics, hormones, etc. And I think that, when we make decisions on keep culling of cows, we're going to have to make decisions on and making sure that we're evaluating our bulls and making sure that we're not culling a bunch of cows that are open that indirectly are being driven open by pregnancy loss from the male side.